with the YouTube, okay? So welcome everybody. We are Today is the first time that we have this streaming live on YouTube. So Haresh Bhai has a question, and so many people do have a question. This YouTube video will be there at in any time. This video will be available on YouTube on Breath Lab. Please subscribe. Request is to subscribe. Just not do this because we really were looking for a lot of subscribers. There's a reason why we do that. I'll give you the background reason. And the background reason is very simple. I hope you understand that. And YouTube and Facebook, I can do only one time, Mr. Natwani. You cannot do both at this time. So I will do YouTube only, just so that you know. And the reason why it's very important to subscribe, many of you know the reason why we do this is because of the fact that there is another group of Breath Lab from University of Miami. They have done some stuff over there, but they have not posted any video for about 12 months, 8 months so far. So they are very inactive. And our group is very active. Our group is going to do weekly. Plus, I just posted, just for your information, I posted one video today. One of my friends, Harish Bhai Shah, is there. We posted a video about what Breath Lab is and what are the benefits, why we call it Breath Lab, etc. So please look at the YouTube, find that video, and give us a feedback. It's just not enough to just look at it and enjoy it. It's fine, but please give us a video back. Feedback, because feedback is very helpful with which we can adjust our programming, adjust things that we need to do. So please recognize that aspect of it. We really appreciate that. If that happens, then we can do more. Second point I want to make sure is that you invite more people. We have lots of room. Okay, we have lots of room, and also you can go directly on YouTube as well. Now it looks like YouTube is working. So we'll be able to do that. And if you're not, if you want to go directly to YouTube and follow that, that's also possible. So these are the announcements. Panaman, do you have anything else from your?
No.
Okay. All right. In that case, let's begin the program. And Panaman, you go ahead first, as we talked about.
All right. So let us all start right away in breathing. Now we have been doing it for several weeks. So most people attending regularly know that we have Kalind Bhai, who is a retired vascular surgeon, Vinod Bhai, who is from Miami, he is a retired pulmonologist, and I am retired primary care. So three of us have started this breath workshop, not only during COVID, but how breathing correctly, breathing optimally is so important for our life. So let us start by breathing and lifting our hands.
Remember to lower your.
Yeah, I know.
Lower a little bit.
I'll stand up instead.
Okay.
So if we can lift our hands and start breathing and breathe out. This time again, start breathing. Breathe out. Breathe in one more time. Breathe out. Now lift arm a little bit higher. Breathe in. And breathe out. Again, breathe in. Breathe out. Now even higher, and at the same time look up. Breathe in, look up, and breathe out. Maybe when you look up, maybe you can smile a little bit. Breathe in, breathe out. So when we are doing all this to not only expand our lungs, push our diaphragms, and try to maximize our lung capacity. So with that, I'll pass on to Kalind Bhai again.
Yeah, thank you very much for that introduction. And if you were going to do one practice, okay, if you're going to do one practice, and if some people ask me many times, what is the one practice you would want to do? Believe it or not, it is this. Because you're sitting down, you're laying down in bed, it doesn't matter. When you raise up, this palm, both these surfaces are like transmitters and receivers. These are the energy channels right here in the center. He said that in yoga also. Many shlokas. I'm not going to quote any shloka here, but karma de, Saraswati. This is the knowledge area, and this is a knowledge area also. This is the area where you transmit everything in our, right, in our capability. And when you give anybody a blessing, this is one of the ways that, at least in India, that they give blessing like this. This is the reason why this is a very important part. So when you raise up, you get the same amount of breath and come down. Now you are connecting the two areas, the heaven and the earth. The heaven and the earth. So think about that as you breathe. And you can, like Panamano was saying, you can increase your breath gradually to the point that you can tolerate. And the same practice is used in number of ways. For example, if you want to go up a little bit, let's go a little bit up, and look up. Breathe deeper and come down, get the breath out. If you want to go up and spread out like this, you will see that all this area also opens up besides the belly. Open up. Inhale. Exhale. The idea is you have to do it very slowly because you rest, relaxation, and that's very essential to relax as you do this. You're switching all the worries and concerns back into the parasympathetic mode. Parasympathetic means relaxation mode. It's just relaxation, rest and relaxation. The heart slows down, the blood pressure comes down. Blood pressure is very responsive. People have high blood pressure, heart disease, even diabetes. All these things are extremely helped just by this. This whole thing is called harmonizing. You're harmonizing your energy. It's like when you have, I don't know if you guys have seen the lassi being made, lassi or the coffee being poured one to the other. It mixes well, see? So we are mixing our energy in this fashion. Think about that and practice, okay? So even if you just wanted to do this for 5 minutes every day, every morning, every time when you want to do this, just 5 minutes, sitting down, but focus, relax, mind to be relaxed. That's the best way to do this kind of practice. And then gradually you can increase the volume, the amount of breath that you can take in. So that is great. I appreciate Panam, that was great. What I'm going to do is I'm going to request Vinod by now to take over a little bit and maybe talk about another type of breathing. He's going to go with another type of breathing and let's learn about it. And we'll practice that once he describes all it. So Vinod Bhai, go ahead. Unmute yourself. Yeah.
Okay, can you hear me now?
Yes, better.
Okay,
Very good.
great.
Thank you. Mhm.
Now, we have mentioned in the past, what is the purpose of breathing? We all know the purpose of breathing is to supply oxygen to the tissues where metabolism takes place and remove carbon dioxide, which is a byproduct of metabolism. And oxygen is needed by every cell, and this is achieved, as Kalind and Pranavin said, by inhalation and exhalation. As we know, inhalation is an active process where we use the muscles to expand the lungs. But exhalation is a passive process, like Kalinbai just mentioned, it's a parasympathetic relaxation. And when you have exhalation, what it happens is like a balloon. When you let the balloon go, everything collapses. So when you are exhaling, there are forces acting on your lungs, which push or creates pressure within your blood, your airways or the bronchial tubes. And the bronchial tubes tend to close. And we have found that this normal breathing is not a very efficient way to breathe. And this is one reason that we have had this breath clinic. And we have been practicing regularly to improve our breathing technique for improving the efficiency. Now, one of the techniques that we are going to talk about is called a purse sleep breathing. Has everybody heard about a purse sleep? Yeah, it's like, you know, in some of our Gujarati ladies carry a batwa. The batwa is the top of the, it's a purse, but which is tied to a small opening. So basically what it means, when you're breathing out, you purse your lips. So you are breathing out through a small opening. Our rishis knew about this for a long time. And this is why when we do Om, when we chant Om, what do? We breathe through the nose and breathe out through our mouth with a small opening. And you feel very, very relaxed feeling. And this is basically what it is. Now, what is the purpose of this purse sleep breathing? The purpose is to improve ventilation. Ventilation is exchange of gases from outside to inside. And the reason why this happens better in the purse sleep breathing, because we keep our airways open for a longer time. When you breathe against resistance, when you're pursing your lips, there is built up of pressure within your bronchial tubes or the airways, which counteracts the pressure from outside. And it keeps our small bronchial tubes open so the air from the distal lungs or the airways or the alveoli or the breathing units, they come out and the stale air comes out. And once you breathe in fresh air, you're replacing with the stale air. This also improves trapping of the lung. And when you are breathing out, it slows your respiratory rate. We have talked before that we are breathing in general too fast. Our better way or more efficient way to breathe is to reduce our rate of breathing. It also improves our breathing pattern. It will become more improved. And it relieves shortness of breath. However, most important, as I said earlier, that exhalation or when we breathe out is a passive process. We don't use any muscles. But when you breathe out against resistance, like in a purse sleep breathing, there is improvement or use of, as Kalind had mentioned before in the past, that the core breathing. So once we practice it, you'll recognize there is use of your diaphragm, use of your respiratory muscles, use of your back muscles, use of your abdominal muscles, use of your perineal muscle. So it's total toning of all the muscles of the core. And most important, this causes relaxation. And when to use this technique, you can use any time, especially when you're short of breath. Anybody who's short of breath, if he tries to use this, it will cut down the rate of breathing, cut down the hunger for air. This is great for people with lung disease like COPD, asthma. So let us talk about how do we achieve this pursed-lip breathing. First of all, we need to be relaxed, like any breathing techniques. You need to sit down, relax your neck, relax your shoulder. I'm just demonstrate once and then we will practice all together. Then we breathe in slowly through the nose. The important thing, breathe slowly, breathe normally. You don't have to breathe hard. Breathe slowly. Just count of maybe 2 or 3 and you breathe out. But while breathing out, breathe out through the mouth and purse your lips. We talked about like the patwa or when people are whistling, but 14th of February, what day is 14th of February? What's the specialty about 14th February? Anybody? Valentine's Day. So what people do on Valentine's Day? They kiss. So it's like a puckering your lips, like as if you're going to kiss someone. So when you are breathing out, and you heard Kalind's wise whistling tunes, that's exactly what happens. And when you breathe out through your mouth very slowly, you will experience tightening of all the core muscles as we discussed before. And also it helps you relax. And again, this in general, anytime we breathe in is shorter than breathing out. Breathing out, you have to do very slowly. So shall we practice?
Yes.
So everybody just relax and experience what you feel. The important part is Kalind and Pannaben has always mentioned, experience what you feel when you're doing this breathing exercise. So, it's just like if you're chanting a mantra or chanting slokas, it will be more useful or enjoyable if you understand the meaning of the sloka. Same way, if you understand the meaning of this breathing technique, you'll enjoy it better. So let us practice. Everybody relax. And then you slowly breathe in, maybe for a count of 3 or so. Let's start it. Relax. Breathe in slowly. Start breathing out. Pucker your lips. Experience the tightening of your muscles, the abdominal muscles, side muscle, back muscles, and you'll feel like tightening of the perineal muscles also. So this, you have to experience this to be more effective. And once you are done breathing out, just relax and then do the process again. Again, let's try now. I'm not going to say anything. Let everybody try. Relax, take a deep breath. One more time. So everybody got a hang of it a little bit? Practice will make you perfect. Most important part of this is don't force out the breath. You're not blowing any candles. So don't force it out. Do it very slowly. Always breathe out longer than breathing in and breathe slowly. Relax, enjoy it. There's no big rush. We don't have to go anywhere. And usually you do it about half a dozen times, about 4 or 5 times a day to start with. And you will see how it is. Or you can use it, let's say if you have been active and you're a little bit tired, a little bit short of breath, use this technique. You will see that you will immediately relieve your shortness of breath. You will also feel more relaxed. And it's a practice. You practice is experience the difference, especially of toning of the muscles. Don't make it as a ritual that You just utter up the tongue like, you're singing Hanuman Chalisa, keep on uttering without understanding what it is, rather than experience what you are feeling. And it will be very, very beneficial. You'll feel the rewards, and it doesn't take that long to do it. And it makes your breathing more efficient. I think I'll get back to you, Kalind.
I think
Vinod,
if I may add one more thing, Vinod Bhai,
Bolo.
is that if what Vinod Bhai described was very peaceful um, in our mind, what we are learning about the breathing techniques, if we count during breathing in up to 1, 2, or 3, and then breathe out longer up to 4 or maybe 5 slowly. And if we do it slowly, breathe in and then pucker your lips and breathe out, count 4 or 5, and do that for 5 minutes, like Vinod Bhai described, and that may also add little efficiency. Okay, Kalind Bhai.
so I have a couple of questions for Vinod Bhai. One question has to do with how is it useful in COVID and pandemic situation? That's one question, and I'll ask you another question after you answer that one.
Yeah, excellent question. I did not want to get too technical when I was talking about increasing the pressure within the airways. When you, as I said earlier, when you breathe out with forced sleep, you are increasing the pressure in your bronchial tubes. And this pressure opens up the alveoli or the breathing units, which is called recruiting. Now, patients with COPD, not COPD, but COVID, as we have talked about before, that their bronchial tubes are collapsed. One of the reasons it is collapsed because there is lack of a substance we talked about, surfactant. And when it is collapsed, you need to open them. And the only way you can open up is by increasing the pressure into your bronchial tube, which is technically called PEEP, or positive and expiratory pressure. Maybe some of your friends or family might have been on a ventilator in COVID, and they use very high PEEP, very high pressure within your airways, which helps to open up the distal airways and improve air exchange.
Very good. I think that's excellent. Besides that, I have a feeling that, and correct me if I'm wrong, I just want to mention something. It gives an extra time for the exchange of the oxygen to happen. Am I on the right track there?
Absolutely. When there is air going in and when you are not rushing up to breathe, that means there is more time given for the air to diffuse, the oxygen to diffuse into your tissues and get to where it is needed. At the same time, it gives more time for carbon dioxide to be released into the airways.
And that's fascinating because you talk about every branch of breathing technique that people talk about all the time. They say only one thing: let the breathing out be longer. That explains very well, Bhai. That's excellent point, and I really appreciate that. The second question I had to do with if you prolong, you're increasing the resistance, right, of air going out because you're puckering your lips, right?
Yes.
So yeah, and we were learning about that some time back in the earlier one to say that this actually creates a little bit more chance of the nitric oxide being formed. Any thoughts on that?
Well, there's theory, but we all know, and we have talked it before, that we have to breathe through the nose. And when we breathe through the nose, the sinuses produce nitric oxide. And it has to go to reach into the alveoli and the lungs because it has got a smooth muscle relaxer. So it relaxes the muscles of the airways or the bronchial tubes, and at the same time, it relaxes the muscles of the blood vessels which are circulating. and it definitely relieves more. And at the same time, when you're slowing down your exhalation, you're giving more time to that nitric oxide to stay in the alveoli where they are needed.
Very good. So now I'm going to demonstrate to you something all of you can do. This is a fun part. This is a funny part of the thing. I do that with children many times. Smile first and take a nice deep breath. These nares open up with smiling because these area opens up. Maybe you just do this. See what happens. Take a nice breath. And only through the nose. We're just still keeping the mouth closed. Inhale. Exhale. Many times it is observed that when we open these nares up, this is the entry gate for the air anyway, like a, gatekeeper there, this is the main gatekeeper. This is alternate gate, this is the main gatekeeper. So when you open that with smiling and breathe in and out, just gently. Notice the amount of air going in when you're smiling. Now frown. Make a real scrunchy face like this. But remember, you are going to be recorded here, okay? Just understand that. I'm recorded too. Frown. Frown. Now breathe in. And breathe out. Do you notice a difference? I do.
Absolutely.
As I get it very tight here with frowning, the area around this closes down a little bit. Now, I'm going to add a little bit of pursed lip, a little variation on the pursed lip. See if that works. I'm just going to add something because I asked a question about nitric oxide, and I do practice this type of breathing. It's not pursed lip, but it is a smile and frown technique. Where would you find it? Nowhere. I just made it up because I practice and I find the benefit of it. So, if you try it, if it works for you, great. So, smile and breathe. Inhale. Now, frown and exhale. Lips are closed. And exhalation is longer. Okay, let's smile again. Frown and exhale slowly. I don't know about you, but when I do that, I feel a lot of warmth here, a little bit warmer here. And the air is coming out not through the mouth here like pursed lip breathing. It's coming out through the nose. Let's do it one more time. Smile and breathe. Frown and exhale. One more time. Inhale.
A friend of mine thought that is my puppy. She says, "When did you get that one?" Who are you?
Make it mutually beneficial.
Yeah.
Okay, so we have a situation where, we are able to now do the inhalation through the nose, which is advantageous, not through the mouth. And then when we're exhaling, what doing is similar to pursed lip breathing. But when you do this and feel the pressure here, let's do that one more time. But then this time you observe whether you are able to feel the pressure here in the belly. Are you able to really control that exhalation? Control of breath is pranayama. Ayam means control. Pran means breathing. So anything you do, control the breathing is pranayama. Forget about the rest of the stuff. People do all this stuff. Pranayama is very simple. It's control of breathing. Very simple. So don't get confused about it. So let's do. Inhale. Now exhale. Make your belly tight, chest tight, and exhale. Little longer. Okay. Inhale. belly tight, chest tight, and exhale. When you do this, relax the upper part of the body. I have a tendency to tighten all this. So let me do that again. Let's see if we can relax the rest of the body, okay? The idea is relaxation also. Inhale. Exhale. Inhale. Exhale. So we gave you a little bit of a variation. It is similar to pursely breathing. And I'm going to demonstrate to you something very simple. If you want to do pursely breathing, something else you can do, I showed you that last time, is you can take a glass of water and a little straw, inhale, purse lip, and exhale. So you put a timer on. This is the way you practice your inhalation timing and exhalation timing. But you can do that simply, and this is a very simple method to do this, and you can practice. But the important point is this, like Vinod Bhai was pointing out, make sure that this is tight, the belly is tight as you exhale, because that is what produces a little bit of extra timing for the alveoli to open up, number one, air sacs to open up. Number two, for the nitric oxide to form. Because, here, of course, it won't happen because we are going through the mouth, exhaling through the mouth. So that won't happen here. The next thing I had shown last time, let me see if I can locate it. Yes, I did. I did show it to you. This is a technique with a balloon. So what we hope to do with these things is, hope you are practicing this. It's okay to be here every Wednesday, but please remember that we also breathe on Mondays, Tuesdays, Thursdays. We breathe, we breathe. So continue breathing, continue doing your exercises. I've heard many times, how often do you do yoga? Well, I do twice a week or 3 times a week. Oh, consistently, morning, evening. But what happens after that 1 hour? Do you breathe or not breathe, or how do you breathe? The whole idea behind all this that we are doing is to change the breath pattern, breathing pattern. It needs to be normalized. It needs to be efficient. It needs to be, so you get a habit of breathing that way. Okay. Just I'm not I'm not lecturing you, but it's important thing that some of these that you may not like one of these, you can pick up your own method that you like. That's fine. But pick up the method that you can practice. That's the most important point. You pick up the method and practice. So this is the way we can do pursely breathing also. Take a deep breath. I'm going to pinch it. I'm not going to show you a variation today because there are a couple of other things to cover today, but this is the pinch it. We have other techniques with the balloon, and I'm going to show you that maybe in the next time or sometime when you get a chance for that. So again, take a deep breath. And hold it. So my question to Vinod Bhai here is, I know that you use for asthma. Asthma is another condition because when you increase nitric oxide, particularly when you go through the nose, it opens up the bronchi, the air passages. It also opens up the blood vessels so that there is good air exchange. So my question to Vinod Bhai is, I know that they have fancy equipment. They have this spirometer and everything else. Does anybody do any kind of balloon or anything like that? Just a question.
Not in general. They don't do any balloon. Again, we focus more on slowing down their breathing and pursely breathing. In asthma and any kind of a lung airway disease, everybody complains of difficulty breathing out. It's not difficulty breathing in. The
Right.
reason why they have got difficulty breathing out because all the lining of the bronchial tubes are swollen. And when you are breathing out, as I mentioned earlier, everything collapses because there is outside pressure. And this cuts down the opening or the lumen of the bronchial tube.
Mm-hmm.
And this is where the pursed lip breathing comes into use because you are increasing the pressure in the airways, which works as an air splint. Like what is a splint? A splint is something to keep open. And the splint is created by the column of air, which is taking time to breathe out. And at the same time, it gives longer time for all those air sacs to empty out and refresh with and remove all the stale air. And this causes improvement or feeling of improvement to the patient.
So, as a pulmonologist, I just want to ask you. I'm introduced a couple of little variations. Are these useful techniques for people who have situations like that?
Oh, I think absolutely. People in our human tendency is to get bored with routine. So if we add some other kind of techniques,
Yeah.
that it definitely improves. It incentivizes the person to do it, and it may do the same thing, but it's a different way to do it.
Really appreciate your feedback here because children love it. Okay, when I do with children, it's really fun stuff. I mean, they blow up, and then I also time it. I've done this timing thing. How many balloons can you blow in 1 minute? It's a lot of fun. I mean, you've got children, grandchildren, whatever. Play with that. Play with them. It's a nice thing to try to do that with children, and you do it too. I mean, you will get improvement. So thank you very much, Vinod. That was wonderful. Understanding about the pursed lip breathing and what are the various areas that how we can do that. And I added my modification. Please don't look for any papers or anything like that. I just go ahead and do myself. I do it. I practice it, and I find the benefit. If you do, great, and if not, that's okay too. But idea is that be careful, and as long as you use the oximeter, like we have suggested to you, you will be able to monitor your oxygen, monitor your heart rate, and all that. So with that, I'm going to now invite uh, Deepak Bhai, and he's going to talk about something very interesting. This is one of his favorite topics. So Deepak Bhai, over to you.
Okay, thank you. Last time we did simple humming. Carol, explained those things. That was simple humming. Today we'll do humming with mouth, eyes, and ear closed. In order to do this thing, we'll have to use some mudra, and that is called Sanmukhi mudra. Now, Sanmukhi mudra is I'm just going to show you right now. That this pinky finger and the ring finger, it goes. Pinky finger goes above the lower lip. The ring finger goes above the upper lip. Then the middle finger, it remains on the nostril, and this index finger, it remains on the eyes, and this thumb we would like to use to close the ear by pushing this ear lid little very slightly. So this is how this is how the mudra looks like. And what we will do is this: we'll sit straight, and then we'll take a deep breath, and we'll exhale through the nostril, doing the humming. And during that time, mouth will be closed, eyes will be closed, and ear will be closed. So let's start this thing. Everybody sit straight, and let's put our, like I said, put your pinky finger and the index in the ring finger on the mouth area, middle finger on the nostril, eyes closed, very slight pressure, and take a deep breath. Close the ear and then do the humming. We'll do one more time. We can leave all the fingers where it is. And when we inhale, the ear should be open. Ear will be closed only during the humming. Okay. So let's do it one more time. Take a deep inhale. Then close the ear and hum through the nose. So this is called Brahmri. It's a very, very powerful tool for especially for sinus related issues. Now we'll also do the humming through the one nostril. In this case, what we'll do is we'll use our middle finger to close one of the nostril. So first we'll close the right nostril, and when we do the humming, we'll close the left ear. Right nostril close and the left ear close when we do the humming. But when we inhale, make sure the ears are open. So again, let's take a deep breath. Close the right nostril and the left ear and do the humming. Let's do it one more time. Like I said, we'll do the deep breath and we'll make sure the ear is open. Close the right nostril and the left ear and do the humming. We'll do the same thing with closing the left nostril and the right ear. So let's take a deep inhale. Close the left nostril and the right nostril and do the humming. So that's all. Back to you, Kanil bhai.
That's wonderful explanation. It's called Brahmari. Brahmari means it's like a Brahmar, it's like a humming bee, let's call it. Humming bee. Humming bee breathing that we do this. And I just want to mention a couple of things before I do a little bit of possible variation, just so that you know how this thing can be benefited for you. The most important thing about this particular thing is the sound vibration. Okay, vibration is an excellent healer. As we do the Om chanting, any vibration, sound healing is well known, and we will get into sound healing and different types of sound and affecting different areas of the body later on. But the sound healing is extremely beneficial. So when you create the sound in the upper area here, few things happen. Number one, believe it or not, this sound goes into the genes. And the genes' genetic makeup is such, in some way, it affects what is known as, I'm not going to go technical here, but there are some ends of the gene, and they're called telomeres. I'm not going to go into details there, but bottom line is it actually reduces the aging process. How do you like that? Humming reduces aging process. Now, there are lots of papers and stuff. I'm not going to go into that. Number two, humming actually breaks down fat. How do you like that? So humming done properly and focused and everything else can actually break down fat. Lipolysis is known. The people use it for obesity. Also, it regulates the metabolism. And then there are so many other, it likes relaxation, it induces relaxation. It switches from what we call as adrenaline to, to a more relaxation hormones like serotonin, and the number of hormones we don't want to talk about details, but it induces relaxation when you do this. Humming, we already talked about that last time. Humming also produces nitric oxide. In fact, this Brahmari or bee, the humming bee, when you do that, it produces 15 to 20 times the nitric oxide. They've studied that with millimoles. They call it millimoles, how much of nitric oxide. That's been all studied. And it creates a lot of nitric oxide. Nitric oxide is very good because it opens up the airways, it opens up the blood vessels. It is also, it does antibacterial, it is antiviral for COVID. So the humming, this is just a mudra that was shown. And I'm going to go into a little bit of a mudra explanation for you a little bit. I won't go details, but what the yoga says and everything, but I'll give you a little bit of an outline today. We'll follow that up more in either breath clinic or some other time. But I just want to initiate that discussion. Okay, that's very helpful, because why in the world these people think about humming? Why are they talking about this? Part of the reason is when you create a vibration, the vibration, sound vibration, and the philosophy that initially it was all vibration. They said how the sound was the first thing that generated out of, and the whole world was created. We don't want to go into philosophy, but what it does here is it can go into different areas of the brain. We already talked about the sinuses where the nitric oxide is produced, and I'm not going to go there right now. But what we are doing here, we're doing this, we're closing off the mouth. We're closing of the eyes. And this is because we are focusing. We are focusing, creating an intention. Focusing, don't look at anything. And we are creating dhyana or meditation like atmosphere for ourselves. It's very crucial to do that. So that's why the mudra is very helpful, okay? But what we do with this closing is I'm just going to ask you to do something, okay? Let's do this very simply. I'm going to simply take 2 fingers and just put it by the ear side here. Now take a deep breath and hum. By the way, the pitch of humming is okay. You can go high, low, it doesn't really matter, because the whole thing, when you do the humming, your face should vibrate, this should vibrate. See if you can practice this, make it louder, okay? Make it louder for you. Now, when you did this, where did you feel the vibration? Let's do one more time, and I want you to notice. You're not closed off any ears. We just have the fingers on the side here. We're not closed off any ears. Now take a deep breath again and hum. For me, I don't know where you felt it, but for me, it was all around here. This central portion. This is the area I felt it. You may feel somewhere different. That's okay. Now what you want to do is now close one ear only. Let's say begin with the left ear. Breathe in. Both nostrils. We're not closing either nostril. Hum. Now, what he said was close the opposite nostril. So take a deep breath. Hum. It's really strange, isn't it? For me, I'm hearing only one side. I'm sending it on one side. So you have a capability to send the vibration to whichever brain you want to. We'll talk more about that when we talk about Anulom Vilom and all how you practice all this. But it's very crucial that you realize that we have two sides of the brain. One is for intelligent, figuring it out, left brain. One is for emotions, figuring out love and all these things, artistic things. And so we have that capability. Now, if we practice this, you know very well that you can help whichever side of the brain you want to. Now, this mudra is great. If you can do the mudra, that's great. Occasionally you find it difficult and you can just do what I showed you, that's fine too. But idea behind this is, why are you doing it? What's the purpose? Am I going crazy just humming? We recommend, there's a book written by Goldman is the last name, and Daniel Goldman. I think it's Daniel is the first name. I don't remember. I think it's Daniel Goldman and his wife. They've written a whole book on humming. And in order to get the most benefit of humming, believe it or not, he's recommending 1 hour of humming a day. You begin with some few minutes, you begin and practice and see if that makes a difference for you. And humming is one of the definite recommendations for even COVID viruses, etc. So apply that if you're in a situation where you are, where you're going to do that, or if somebody has had it, etc. Humming is going to be extremely powerful. Okay, so we introduced the Brahmari today and all the stuff, and I think I'm going to close it off now, and we'll open up the question and answers for everybody and see if we can address some of that. I'm almost done here. If you have any questions or anything like that, we can address it. Do you have any announcements, Panavan?
I was going to very quickly go over the COVID precautions.
Oh, sure.
So
Sorry, I apologize.
No problem. We are into more than a year into COVID, and most of us know how to take care of ourselves. But little as we are learning breathing, we also pass on to everybody the correct way to optimize our breathing. So by now we all are used to keeping 6 feet distance, wearing even double mask, and washing frequently our hands. When you are yourself not healthy, you have some medical issues, we also by now have learned to stay by, not to be exposed to other people, not travel in mass travel or in air or in the cruise. So all those things by now we have become expert. Other thing is to stay safe, like Kalind bhai, Vinod bhai, and all of us are experiencing, we should breathe in deep. And as Kalind bhai just explained, as we breathe deep and as we produce more nitrous oxide, we are protecting ourselves actually. We are protecting because it does fight COVID virus. And so breathing deep on a regular basis. Today, we learned in detail about the pursed lip breathing, and also periodically coughing strongly. You breathe deeply, like we discussed in the beginning, in and out, and then forcefully you cough out. That also helps. So deep breathing. Also, we have learned many a times belly breathing or diaphragmatic breathing. So that is to stay healthy. So deep breathing, the diaphragm is activated, lung capacity is increased, and not only just by during practice, just this kind of the specific breathing activity, but all the time, whatever we are doing consciously, even while lying down, it not only helps with breathing, it helps with stress, anxiety of possibly developing COVID or during COVID. It helps inducing sleep. So it does help in many ways. If we experience someone, if we don't know whether other person have COVID and we are near them, so how do we handle it? Sometimes we come near close, of course we are wearing mask and protection and everything, but at that time, if we can even hold momentarily, we are experiencing breath hold practices, so we hold for a little bit, or what is called light breathing. In maybe in the future sessions we'll learn what is called light breathing, deep breathing. So if we can do it, that kind of breathing, we can minimize our chance of getting it. Also at that time, when we are holding our breath, we are producing more nitrous oxide, so that way also it benefits. Um, also when somebody does have COVID, they can do this breath hold practice as frequently as they can. Also, they can walk around every hour 10 feet or 10 steps as much as they can. That helps. So, in general, to improve our lung health, it is recommended to do the belly breathing. Belly breathing when you are lying on your back, belly breathing when you are lying on your stomach, while sitting, while standing, any position you are, you can do it, and hopefully that will help you. Thank you.
Well, thank you very much. I mean, it's been very useful. That's few points. We're open for any comments or questions at this time. The official presentation and our practices are done. Those who want to stick around a little bit, you're welcome to do that. We'll stay around for a little bit time for questions and answers. But I do want to tell you that this has been on live tube. I'm going to stop the live tube now, stop the live stream.